Hello. I'd like to take a look at a topic that I'm going to call, why do some partners use the silent treatment? Here are some observations I've had on this. Well, first of all, what do we mean by the silent treatment? Some people in marriages and other relationships probably don't have any idea what this would mean, while others not only do, but are exasperated by it. Particularly if this silent treatment is used, say, pretty frequently by women toward their male spouses or partners, where the one partner will be very quiet and say nothing for days sometimes, or even weeks. You might say it's an attempt to manipulate, but is that always the case? Maybe there's a self-protective measure going on here, and I'd like to take some look at this. Now, for instance, there is a specialist on the topic of narcissism, a Dr. Ramani, who talks of how some narcissists will use, quote, the silent treatment to try and get narcissistic supplies, as she puts it. Or, as I would say, trying to get someone like a partner to agree that this person is number one in the world, and by the way, that the partner is not the other person. And then, hence the idea of trying to get narcissistic supplies, validation that the narcissist is number one or perfect. But I don't like using this word narcissist, first of all. It's a fairly toxic word, especially when you consider that, according to a good friend of mine once telling me, she said, in her opinion, almost everybody has some degree of narcissism or desire to feel number one, in my opinion now, for a sense of safety. So I think we should perhaps be a little careful and just say that all silent treatment being, quote, administered to someone else is simply an attempt to get narcissistic supplies or to have a partner agree that they're number one. For instance, if we're going to talk of that, while that could sometimes be true, what about trying to get supplies of other sorts by the same means? For if you consider that the belief you're number one can be regarded as an illusion, even possibly a delusion, well, surely there are other kinds of illusions or delusions too that we suffer from so frequently. And so you could say silent treatments can sometimes be utilized to get a partner, say, to agree with some other kind of illusion or delusion, if you will, that they may hold. Well, I don't want to get into what these may be, these alternative illusions to being number one, but surely they do exist. And so I just would mention that. For wherever we have an idea that is not correct about us and is not getting backed up very often because it isn't correct, well, I suppose we would want validation, if you will, or supplies, as Dr. Ramani puts it. We want confirmation that our idea is correct, especially if we're not getting much feedback to that effect for possibly a very good reason, because people don't agree. Now, on the other hand, I would say that sometimes we may want to have validation on an idea that we're correct about, but our society doesn't either see very often or want to acknowledge. So we can sometimes even use a silent treatment to try and get supplies, if you will, validation about something we're correct on that we're not getting feedback on, and that hurts. So this is not so simple, I think, to take a look at. Now, If we're going to talk too of the desire to get validation, so to speak, from someone else and try and force it through not talking to them, well, what about considering these illusions we want validated to be a kind of defense mechanism? And what about then other kinds of defense mechanisms we may be using in life? And you could call them, in a sense, bad habits, say, or addictions, and maybe they're quite noxious to a partner. Overspending money, gambling, drug and alcohol addictions, and maybe difficulties holding a job, and other matters too. Use of too much aggression, or an aggressive partner and the other person isn't aggressive at all and can't handle aggression, moreover. Or maybe there's a difference in religious viewpoints, and one partner wants validation that they're correct, and when they don't get that validation, they may use the silent treatment to try and get the other person to convert, if you will, to provide validation that their views on some religious view is correct. Now, it strikes me that when we're talking about a bad habit that we may want a partner to change, well, are these habits always so easy to change? Especially if we consider them defense mechanisms for anxiety. If you can't purge the anxiety somehow, say through some form of therapy or medical treatment, termed medications, or let's say cognitive therapy or depth therapy, psychoanalysis, especially in the past, or application of religious concepts and religious worship and reading scriptures and so on. If all of that doesn't help much, then how can we expect a defense mechanism to go out of use? The silent treatment, thus, is an attempt perhaps to have somebody change a defense mechanism and get rid of it. But what if that isn't very easy, or they have nothing to substitute it with, some other less noxious defense? Then I suppose this is going to be a war between two partners of sorts, where there will be frequent use of this silent treatment, or I suppose some would say passive aggressiveness, that there's some application of that, although I don't know the ins and outs of that phrase, passive aggressive. So you might say then that one partner wants the other to change some habit, some defense, if you will, against anxiety, and they're tired of bringing it up verbally to no effect. It's sort of like saying, I'm tired of you smoking, and the smoke in the curtains and the carpet, etc. And if you don't change after I've brought it up 50 times, well, I'm just not going to talk to you anymore. We'll see how that goes. But I suppose anybody who has smoked or known someone who smokes, generally to calm anxiety, or maybe pick up their mood, or clarify their thinking, well, I suppose this isn't so easy to change, is it? And we know that from experience we've had either ourselves or with friends and relatives. One relative of mine, for instance, who graduated from Oxford College, Oxford University, with a theater major, master's degree. She had a problem with smoking, and of course she tried over and over to quit. And it was perhaps a crowning achievement in her life to finally quit once for all, to finally end her difficulty with smoking. So in the meantime then, anybody who knew her well, if in a relationship with her, would have gotten very frustrated bringing up this issue of smoke in the home say over and over, and at one point may have just said, I'm not going to talk to you anymore until you change. And so you could call this then the silent treatment toward a habit or a defense mechanism in general that is very fixed in nature, very difficult to eliminate. And the point, too, I would say, is in relationships and in general in life, I think we all use defense mechanisms, and not one person on the planet doesn't, or anyone who has ever existed doesn't use at least one defense. I'm reminded, for instance, when I was in my 20s and in-depth therapy with somebody, the therapist once said to me, after I said, I'd like to get rid of all defense mechanisms in my life, and he said, well, why would you want to do that? He basically said, I think the upshot was he knew that would be a tall order, requiring your entire life's effort, first of all, and second of all, I think even the greatest of analysts or Buddhists, what have you, probably could never pull that off. And the Buddhists would probably say you've reached enlightenment if you could do that, but I'm not so sure myself there is such a thing as enlightenment, because then you're talking a person who's perfect. I think all we can hope for is that if we have a defense mechanism, or habit, if you will, or even addiction that is noxious to others, that we somehow in time can dial it down some, or substitute it with something less noxious, a different defense mechanism. So say the person addicted to heroin or meth or drinking too much may go to a rehab center, and I defy you probably to find someone coming out of rehab these days who isn't given a, quote, medication to treat this, and they're told they have a dual diagnosis, and the point being that even in, let's say, 30 days, that is totally inadequate as to the amount of time necessary, I believe, to conquer all anxiety in life. And so you'll have to have some kind of defense mechanisms, and if it isn't going to be alcohol or heroin or meth, well, it's going to have to be something else substituted, and you can't dial down that level of anxiety, strong levels, in 30 days. So something like methadone or buprenorphine, say, may be prescribed, and then the person has a different set of defense mechanisms to substitute that are less noxious in a number of ways. So I think that's about the best we can hope for, is a dialing down of the need for a defense by dialing down the level of anxiety over time, addressing it with cognitive behavioral therapy or depth therapy, say. But in the short run, we might be talking a radically sudden change in defense mechanisms, or, in other words, use of some kind of prescription drug to have an alternative method completely suddenly reintroduced or introduced to deal with high levels of anxiety, including trauma or living situations in general. Now, whether there's a lot of side effects to those drugs or not, that's a good question, and the cost. And whether or not one wants to apply some therapy later on of some sort to try and cut back on the level of drugs used in the future, and possibly eliminate them through cutting back the anxiety in other ways. Like again, therapy involving reframing, say, of the whole situation one is in. Or talking in terms of Buddhist ideas of acceptance and mindfulness meditation, calming oneself down too. But the upshot is, I think, that a silent treatment usage is really quite toxic to a relationship, and especially if used over and over and not addressed. Eventually one may just have to say that somebody's habits are so noxious that they recognize it's unchangeable and there's just going to be some kind of restructuring needed in the relationship, either less time spent together or certain different ways of interacting during the day and evening, or possibly just even an end to the relationship. On the grounds of incompatibility, you might say, where somebody's defense mechanism is incompatible because we deem it to be toxic to us. So you might say then some divorces are on the grounds of incompatibility in that the other person simply can't change in the way we want them to, and that silent treatment, say, applied under the notion that someone can change instantly and get rid of all defense mechanisms and like use free will and just say, I'll pick myself up by my bootstraps and change, and I'll make alterations that are impossible for anyone except Houdini. Well, I suppose that's the source then of divorce sometimes, and perhaps for good reason. For who can tolerate days on end, months on end, years on end, the silent treatment here and there? Now, other sources I think of the silent treatment, so often particularly used by women, I think, and it involves a difference, say, in views on sexuality and the amount of sex happening in a marriage, say, or relationship in general. Oh, say one partner wants to have so much more sexual relations than the other. Well, they may try to force that on the other partner then, and if there is a power imbalance, let's say in terms of the amount of money being earned by one partner, or difference in size or ability to assert themselves because they have high levels of anxiety toward violence or low self-esteem, well then I suppose the silent treatment is in their mind the best way of defending themselves, for they don't have the ability sometimes to use self-assertion. Their anxiety levels are too high, and sometimes they may actually get hit. So violence being involved if they were to confront openly in verbal discussion. So the silent treatment then coming in as a compromise solution. And I believe wrongly to call this passive aggressiveness if the partner has no better options. It's a coping mechanism. And just like some would argue lying is a coping mechanism when your life is in danger, and that it's not necessarily a moral failing then. It's a matter of coping under toxic circumstances. There may be, too, a partner who is very controlling, perhaps very much aggressiveness used in this respect, too. And so the other partner perhaps is almost defenselessness against a considerable amount of aggression used. Other than to just say, if this doesn't stop, we'll have to end the relationship, or put severe constraints on it. You may call it boundaries. But that's not so easy to do sometimes, I think. And so then the silent treatment can come in again as a defense, a way of coping, perhaps the best way if a relationship cannot be ended or modified somehow. Indeed, this controlling by one partner may be so noxious that it's to the extent of violence being used, and as a form of control, influence, and then this is very problematic, especially again if there's a power imbalance as to size of one partner or financial resources, or maybe the partner has children and there are issues involved there then too. And maybe there are religious issues where, according to their faith, divorce is forbidden. So then I think especially the silent treatment would come into play in such relationships where divorce is not permitted, let alone not so easily financially made to happen. Now, I would say that the silent treatment is typically so much more effectively used by women, by the way, because, in my opinion, women tend to be much more empathetic than men by way of genetics. There having been such for eons as the best way to raise children, say, children needing a lot of empathy as they're growing up, and the mothers spending the most time with the children, at least in the past, compared to a husband, a male. And so it's to the women's advantage to have a lot of empathy, and that then becomes a tool, a source of power, if you will, I believe, whereby the woman then knows that the man will either have to turn to another woman somewhere else for empathy if he's not getting it from his spouse. In other words, empathy in terms of soothing and validation, say, and of course sexual relations too. And thus the female partner knows he would either have to turn to another woman or really have a much more difficult time finding someone to soothe them, because people who are men may want to discuss football and hunting and how to make money and how to get ahead in life much more than they want to discuss feelings or struggles in life of a more basic nature. So then the male is between a rock and a hard place of sorts, and can very easily be swayed. For the man knows, once again, that his options are quite limited for possibly finding someone of high empathy to soothe him. Amongst other things, as I've mentioned, he probably wouldn't want to turn to another person just like him who wants to work on his automobile most of the time in his free time, or watch sports once again. Talk about guy stuff. And that probably isn't going to cut it when he really needs someone who can understand more empathetic-based ideas, feelings, in other words. Now, of course, I'm making a generalization, but I think in many cases, let's say in America especially, this is true more often than not. For, take the example of the noted psychoanalyst Rollo May, who had written many books on anxiety, and in one of them, The Courage to Create, he said that Americans have 3 to 10 times the level of violence than in Europe. So, you would have to wonder then just how empathetic many males can be in particular as compared to some in some other countries. And so this would enhance greatly, I think, once again, the power of the silent treatment as used by a woman. Pluses and minuses all considered. I'm not talking here in terms of morality or pathology necessarily. Now, I would add one final note here, and then that will probably be it for this. And that is, it's my observation that sometimes the silent treatment can be used as a way of displacing anger, say. Say oftentimes from some trauma in the past, or past treatment from a spouse or partner that hasn't been resolved, discussed, laid to rest, forgiven, so on. And so this unresolved issue or issues from the past, maybe even trauma from childhood, generates anger, of course, even rage sometimes, and maybe the person who even caused it is unavailable to discuss it with, or displace, dump your anger on, force a confrontation with, and so the rage gets put on the marriage partner or other close relation. And what better way of inflicting pain on someone else? Again, displacing rage, making the feeling less in the short run by making someone feel hurt when you don't talk to them. And furthermore, having them feel confused as to why this is. whether it is partly their fault or not, so that they don't even know how to address this further. So, to recap that part, then I would say again that the silent treatment can be used to dump rage on someone else that doesn't even have anything to do with that partner necessarily. It could come from childhood, and maybe no therapy has ever yet been able to address it. Or maybe the person doesn't even know they need to address it. Their pain is on a totally unconscious level. So, for instance, one practitioner I saw once for therapy 15 years ago said to me that he worked with a number of women who had had sexual abuse issues in their childhood, and he said on average it took the woman a year to even realize she had abuse. And so in the meantime, I'm sure she had a lot of rage and anger, and this then having to go somewhere surely to relieve the pressure. And what better way, I would say, than to use the silent treatment sometimes on a partner to inflict pain on them and make oneself feel better in the short run, and neither partner then really understanding what in the world is going on, to the detriment of the relationship, I'm sure. Not to mention a possible countering with violence, say, or ugly treatment in response. A tit-for-tat relationship, basically, that's very confusing and needs a lot of illumination and, of course, patience to work through if one wants to work through it. So, at any rate, these are my observations on what is typically called the silent treatment and how it isn't quite so simple, I think, as it first appears or is talked about. When someone might say that the one person is just trying to get narcissistic supplies and doing it by using, quote, the silent treatment. I think it can be much more complex than that. And I would hope that somebody might try, if they want to get to the bottom of it and have the resources, that they look into some kind of assistance, if you will, therapy or religious assistance, call it therapy too, or mindfulness, to get to the roots of this to some degree. I hope this is somewhat helpful, and I wish you well today.